Yes, we're live now, and I've worked out that there has been some comments on the story on Facebook, which is very exciting. And I now have been able to visualize said comments. So I'm going to just do those first because I can see me forgetting that. So the comments on Facebook stories says, is it okay to have a full open hysterectomy surgery 5 years after a full tummy tuck with MR? MR being muscle repair, which I now know. Yes, absolutely fine. So absolutely fine to have a hysterectomy after a tummy tuck. The MR, the muscle repair bit, means bringing the rectus abdominis muscles together in the midline. The incision usually for a hysterectomy is in the crease, which is like where you have a cesarean section scar. So it's normally sort of horizontally orientated. Well, same as a tummy tuck, actually, same sort of scar, but not as long. The muscle repair is going vertically up, if that makes sense. So they probably won't interrupt or do anything with the muscle repair at all. But 5 years down the line, it doesn't matter. The muscles will have been brought together. They will be scarred together. So it's completely irrelevant and nothing to worry about in terms of the surgeon doing the hysterectomy. And I'm sure the surgeon's not worried, but if they are, I always say, look, if you can get them to speak to your plastic surgeon, but there's no real need. I think his gynecologist would be fine doing a hysterectomy if you had previous surgery. The only thing is you'll have scarring there, but the scarring will all be superficial. And so it just makes it a little bit more difficult because of the scar tissue. And I would personally advise them to excise the portion of the hysterectomy, portion of the abdominoplasty scar, rather than giving you a new one. Sometimes you see people giving a new scar, and I'm like, why have they done that? So you've got two scars. I would just excise that portion of the abdominoplasty scar in order to do my hysterectomy. But yeah, no problem at all with that, with having a previous tummy tuck. And we've got two. So next one, glad I checked because I normally check afterwards. What to consider months or weeks before breast augmentation for someone with regular anxiety attacks? Yeah, don't over egg it. Don't overdo it. Don't don't lay too much onto it. I mean, clearly this sort of surgery is going to be anxiety provoking for anyone. I mean, I can't say don't be anxious about it, because I think anyone would be anxious about it, and it's perfectly normal to be anxious about it, but don't be that anxious about it, and try and focus on the positives, on the reason you're having the surgery, on the effects that you can hope to achieve once you've had the surgery. So those are the sorts of things I'd be focusing on. In terms of the risks of surgery, you have to know about the risks, and you've probably been told the risks, and you've kind of accepted those risks before deciding whether to have surgery or not, because obviously you've got a decision whether you have surgery or not. And the risks are low, but they are there, so you have to be aware of them. But once you've accepted that and think, yeah, the benefits outweigh the risks, I would just try not to think too much about the risks after that point. I think it's, I'd say, not saying don't think about them at all, but once you made the decision to have surgery, don't kind of focus on the negatives and on what if this, what if that. Try and be positive about it, and try not to think about it too much. And just as I say, think about the outcome and what you're hoping to achieve, and what the result you can get. That would be my advice for that. I'm not really an expert in kind of anxiety treatment but that's kind of my advice I would give to anyone. And as I say, it's completely normal to be anxious about this sort of stuff. So and thank you so much for asking a question on the story. That's both of you very welcome addition. And also we got a question live here, which I've seen. How to create a tighter hourglass shape with tummy tuck? Is it with lipo? What I would say, Berry, hope you don't mind me calling you Berry, is that try in your mind of thinking about what we are doing as surgeons. So we're kind of working on the shape that you've got, and we're trying to sort of work with that and adjust that and make that as good as we can. So it's about realistic expectations. I don't know what your figure's like now, but I mean, we're always trying to make an hourglass figure, but you got to think about where you are now. Usually a tummy tuck involves taking out skin and fat in an up-down direction. Now, having said that, when we close it, we often close it to bring the sides in to give you that up-down, to give you that hourglass figure. So we're trying to close it by bringing those sides medially. It does create a bit of puckering medially, but I don't know if that makes sense. But we try and pull the sides in to give you a nice waist and a nice shape. But it depends on kind of what kind of shape you are now. If you're quite kind of square, you might be a little bit square afterwards, although you won't have the apron. But you know, you might not have perhaps as good a definition as you might want. And so this is why you need to have these conversations pre-op, because you don't want to be surprised post-op. There is a procedure called a fleur-de-lis tummy tuck, where actually skin is taken in a kind of side-to-side direction as well as the traditional up-down direction, and that does narrow the waist, and in some respects it will give you a better shape in that respect, but it gives you a big scar up the middle. So it gives you a straight line scar up the middle as well as the horizontal scar. So it gives you like a T, inverted T-shaped scar. So there are negatives with it as well as positives with it, but that's something that is sort of going through my mind. If someone's saying, oh, I really want an hourglass figure, I mean, liposuction is really good on the hips and flanks, to contour those hips and flanks, to try and make that hip area less full. And so this is why you probably need a discussion with your surgeon in terms of what sort of look you're after, because sometimes people say, well, I like that fullness on my hips, and that might be what you're describing as your hourglass figure. So you kind of might not want liposuction. Usually most people have some degree of excess on their hips and their flanks, so it does give a better shape, a better contour if you can take that fullness off the hips and flanks with liposuction. But again, it needs to be having a discussion with your surgeon as to sort of what sort of look you're after and kind of what you mean by an hourglass figure, I guess, and to see whether that's realistic given the body that you've got now, whether, you know, how much that can be transformed with surgery, and being aware of the potential limitations of what could be done so that you can weigh up whether it's worth having surgery. But yeah, I would say repairing the muscles, like I was talking about a minute ago, is a kind of standard part of the tummy tuck, which brings those muscles together and can help that definition at the sides and help with that hourglass figure. And personally, I don't do the fleur-de-lis very often where I make the incision. I usually just do muscle repair and try and bring the sides in with keeping just a horizontal scar, and trying to make the shape as good as I can. And I usually show photos to patients of some of my cases to see what they think. And if you think that's good and that you might want the same, great. If you think that you want more of an hourglass figure and want it to look a bit different or whatever, I'm like, yeah, well, this is kind of what I can achieve. So, you know, I want to be realistic about what I can achieve before surgery, rather than saying, oh yeah, you're going to get a lovely hourglass figure, and then you have surgery and you think, I've just really got rid of the apron, I haven't really got that figure that I wanted. I'm like, yeah, well, that's because all I did was get rid of that fullness. So it's good to have a question now, and it's a good question. And yeah, should have bought a glass of water, memo to self, but that's a good question and probably needs a discussion. Really hard to do it in this forum. Demi Hammonds. I already have an hourglass shape. Do you do book style tummy tucks? Oh God, I hate it when people say things on this and I'm thinking, I'm really sorry, Barry. What's a book style tummy tuck? Book style. Book? Could book be a typo? Book style tummy tucks? Oh God. Sorry, Barry. I don't know what. Oh, here we go. Ah, yes. This was a type I want. I understand this car, but I think would give a better result. Do you do these often? Do you mean so fleur-de-lis? Oh, is book? Maybe book means like a sort of like with like an H on its side scar. Is it? So is that what you call a book style? So anyway, so I don't do the H one where they take the top and the bottom. Don't I mean, it's difficult because you have to do what the patient wants, but I don't like that scarring. And I've got to be honest with you, Barry, I don't do many fleur-de-lis. I do some, but it's not, um, what is it? One in 10, probably less than 1 in 10. 1 in 20 or 1 in 30, not that often. I don't do a fleur-de-lis often. Fleur-de-lis being the kind of inverted T shape. So I don't do the fleur-de-lis shape, and I don't do the kind of H on its side shape, which might be what you're talking about, book style. So yeah, not looking good, Barry, not looking good here. So I might not be your man if you want one of these kind of extended ones. They are good, but I'm a bit like, if you're saying you've got an hourglass figure already, I'm not sure about having all that extra scarring. So that's something I would sort of think about, because it can be a little bit obvious that scarring go out the middle. That's why I personally don't like it, the fleur-de-lis. So I feel that personally, often the best compromise between taking out more skin and giving a good cosmetic result is a full tummy tuck, which is one scar goes from hip to hip in the lower abdomen. That's kind of like, often the balance is there in terms of it removes enough skin and gives a good enough shape without giving any obvious scarring if you were to wear a bikini or what have you. I mean, there is a scar around the belly button, but we try and kind of hide that as much as we can. So in terms of when you're in underwear or when you're in a bikini, that doesn't really show. Hopefully it doesn't really show, and sometimes it might if you're wearing a sort of thin bikini or what have you, but it does. It often is a bit easier to hide than when you start putting scars in the middle. I have hourglass syndrome. I'm not sure the medical term for it. I have loose skin under the breasts, then flat, then apron. Is it Ehlers-Danlos? Is that what you mean? Ehlers-Danlos, hyperelasticity of the skin, maybe. Maybe that's what you mean. So yeah, Ehlers-Danlos. If it is that, if you do have hyperelasticity of your skin, then that can have an effect on wound healing, and would be another thing to take into account if you are going to have surgery. Because if you start getting into T shape or H shape scars, when two scars meet, there's an increased risk of wound healing problems. So again, another thing to think about if you were going to consider a fleur-de-lis, it does increase your risk of complications with that T junction. So sounds like you are not a straightforward case, Barry, my friend, but very interesting all the same. So I think it needs a discussion of like with anyone, pros and cons. There are definitely pros to doing more skin excision than doing extra scarring, but there are also cons, obviously. So it's where the balance lies in your particular case. So that's a combination of chatting to the surgeon, seeing what you have got in terms of your skin excess, and trying to make the best plan that you can with the information available at the present time. It's the hold on a minute. Well, we got Facebook. We got some questions. There's a bit of audience participation tonight. Atkins, I can see you've asked something, but I will do Sue, because we've got Facebook questions. Look at this, we'll queue them up here. They're queuing up. Hi Jonathan, I'm 6 weeks post surgery. Is it still normal for swelling all on my belly and mons? I'm in the clinic next week for follow-up. All on my belly and mons. Yeah, is the answer to that, Sue. I've got to be honest with you, Sue. 6 weeks is early days. I normally say things start to settle. Highlight and bold that word "start" at 3 months. So we're, if it's 6 weeks, we're kind of halfway there. So halfway to it starting to settle. So swelling on belly and mons is normal, completely normal. Particularly if you've had liposuction in those areas, and so it's completely normal with this operation. So normally we're looking at healing, we're looking at scar, we're talking about scar management. In terms of shape, I normally see in about 6 months, and then we've got an idea. And even then, it's not fully settled. To be honest, the scar might still be a bit red. There might still be a bit of swelling. Shape might not be quite right. But 6 months, it'll be on its way. And then 12 months is kind of where you get to think where you're going to be. So Sue, panic not. 6 weeks, early days, often swelling. So I normally say to people wear the binder day and night for 6 weeks, but sometimes people want to wear it longer because it can be swollen for longer. So if you want to carry on wearing the binder, especially if you've got swelling, then it might be worth thinking about that. But totes normal. Sharon Joanne, is it safe to have an open full hysterectomy? Oh, hold on a minute, we've had that one. Oh, Sharon, you must have 5 years after a full tummy tuck must repair. Yes, it is, Sharon. I answered this at the beginning, Sharon. I did because I saw you put a note on the story, which I'm very, very grateful to you for. When I say safe, will it impact my tummy tuck results? No, it won't. Well, the only thing is that they'll take out the scar. I imagine they'll take out the central part of the scar, your tummy tuck scar, so you have a fresh scar. So that will impact it. But in terms of your muscle repair, it won't impact it at all, or it shouldn't impact it at all. They will inside. So you've got two muscles, six-pack muscles, which are next to each other, which they will have brought closer together when they did the muscle repair with your tummy tuck. They call it muscle repair. You're not really repairing the muscle, I'll be honest with you, when you're doing a tummy tuck. You're just bringing it close together. So it's because the two muscles are spread apart, causing a gap between them. So you bring them together. So it's not kind of really repairing the muscle, it's bringing them closer together. When they do the hysterectomy, they will actually cut through the muscle in the lower portion. So they'll cut through at sort of 90 degrees of where where the muscle repair would have been done. So they'll cut through the muscle in order to get to your hysterectomy. So it's fine, and it won't impact your result of your tummy tuck. It won't make your skin any stretched or anything. It's just cosmetically speaking, they'll give you a new scar. That's all. So that might be an impact. But apart, I wouldn't worry about it. Is a point, Sharon. If you need a hysterectomy, don't worry about it. Your tummy tuck's in the bag. You had that 5 years ago. You've got the result. You've got happy days, and you're starting. What a lot of cosmetic surgery does is kind of resets you back to a better place. So you've been reset back to a better place, and now you're moving forward from there. So the tummy, the hysterectomy may or may not have an effect on the cosmesis of your abdomen, but at least it won't undo any work the tummy tuck's done. Put it like that. It'll just, you're at a good place, hopefully, and hopefully you'll still be there. But there will be consequences of having a hysterectomy, and in terms of the scarring, etc. So that's something just to deal with as you move forward, which is what you would have done if you hadn't had a tummy tuck. It's fine. So don't worry about it. Atkins 9. If someone was unsure on mastopexy with or without implant, would you offer the operation in 2 parts, or do you only perform this in 1? Yeah, absolutely, Atkins. In kind of like the other way around, I would always say to people, there's a lot to be said for doing it in 2 parts. I think, kind of like the standard is doing it in 2 parts, and many surgeons only do it in 2 parts. I think it's kind of, I think most surgeons would do it in 2 parts. Only a few surgeons do it in 1. Rather than the other way around. I mean, the people who do it in 1, it's not like they wouldn't do it in 2 parts. I think anyone who does it in 1 would be happy to do it in 2 parts because it's less risks if you do it in 2 parts. The complications are less if you do it in 2 parts because when you do a lift, you're making it all tight, and then you put an implant and you're making it tight again. So there is, if someone's saying, oh, I'm not sure, I'm borderline, what do you think? I would always say, we'll do it in 2 parts. Do 1, see if you're happy, get it all healed. 4 to 6 months later, do the other one. Is the cost implication in doing it in 2 parts? Yes, there is a cost implication in doing it in 2 parts. So it is more expensive doing it in 2 parts. There is kind of economy of doing the operation in one go, but the complications are higher. So the risks are higher when you do it in 1 go. And particularly if you're borderline, it might be that you're happy with, if you're borderline sort of, definitely want implants, not sure about the lift, or definitely want lift, not sure about implants, you might be happy with just the lift or the implant. So you might not actually need that second operation, in which case, obviously, it's cheaper. So kind of like a bit of a gamble, because you might not be happy and think, oh, God, we should have it done in 1 go. But as I say, in terms of surgery, risks and complications, you're always going to be better off doing it in 2 parts because you're reducing your risks. But you are putting it over 2 operations, and potentially, if you, for instance, if you want implants, if you definitely want implants, potentially you're going to be unhappy for that 3 to 6 months because you're not going to have the volume that you wanted. Or similarly, if you definitely wanted a lift, you're not going to be happy if you have the shape's not right for those 3 to 6 months. So I always have a discussion with patients, and we'll offer it in 1 stage. But as I say, if there is a a doubt, there's a lot to be said for just going for it in 2 parts and seeing how you get on. But yeah, good to be aware of everything pre-op, as I said earlier, certainly in terms of cost, so it would be more costly. Sharon, thank you, Sharon, for participating. Can you recommend a good surgeon for chin liposuction? Yeah, because I don't do chin liposuction, obviously. Otherwise, that would be a funny question. I mean, I guess it depends on where you are. You're welcome, Atkins. Very well, very welcome. I guess it depends on where you are, because I would, try and find someone close to where you are. Look for someone who does faces. Someone around here. If you're in Birmingham, West Midlands, got to be careful. I don't want to upset anyone by not mentioning them, but Guy Stern, I know Guy Stern quite well. He does facial liposuction. Mahbub Ali, the 3 of us used to work together. So Guy and Mahbub are good friends, and they would offer this sort of thing. So yeah, I guess that's the start for the West Midlands, and wherever you live, I might have an idea of someone, but basically a fully trained plastic surgeon in your local, in your locale would be my suggestion there. Why don't we offer pinnaplasty to patients under the age of 18? Yeah, so it's quite common to have pinnaplasty in patients under 18. Pinnaplasty being prominent ear correction. Simple reason is that we can't because of the CQC. So the CQC will kind of approve the clinic, or they kind of inspect the clinic, and when you register with the CQC, you have to say what you're doing and who you're treating, and specifically whether you're going to be treating children or not. And if you say you're going to be treating children, there's an awful lot more work to be done, and staffing, and it's quite difficult to get approval to treat children, to the extent that the hospitals are actually struggle to get this approval sometimes. So it is quite difficult to get this approval. And when I look at the amount of work that we do at the clinic, there's only a minority that would be children. Pinnaplasty would be one, maybe moles and cysts. People have talked about tongue tie and things like that. So there are a few cases that might be there, but it really is a minority of the sort of thing that I do, because most of the work is on adults and over 18. So it just wasn't worth us going through the what would be needed to treat children. So that's the only reason we don't offer pinnaplasty, or indeed anything. We don't offer any kind of procedures or treatments to people under the age of 18. So you would have to go to the hospitals, and as I say, they're making it more and more difficult to treat under 18s, but we don't do it. So that's it. Not because of any other, not because of any sort of ethical thing or anything like that. I think it's perfectly reasonable to have a pinnaplasty under 18. In fact, often you have a pinnaplasty 6, 7, 8 years old is kind of a normal age for a pinnaplasty. Kind of when you want the you really want the patient to start asking for it. So that's kind of the criteria for pinnaplasty. So they tend not to do it on really young children who don't feel that they've got a problem, but if they are having problems at school and things like that, I think it's perfectly reasonable to do that. So following on from that, can you recommend a surgeon that would offer pinnaplasty to a 13-year-old? So again, it depends on where you are, where you live. But if you're in Birmingham, you'd probably want to look someone in the Children's Hospital. So Khurram Khan is a great guy, surgeon in the Children's Hospital. I know him, so he would offer a pinnaplasty. Problem is, a lot of the people I know now, they like retire, because I'm thinking Bruce Richard, but I got a feeling he's retired. Let's say Khurram Khan. Khurram Khan's a good guy, and he's not retired. He's a young guy, so he's going to be pushing on, so for a long time. So yeah, Khurram would be my pick for that. What do we got? Olivia's in the house. Hi, Olivia. Hope you are well. I'm well, and I hope you are well too. Lorena, God bless her. Clapping or waving emoji. Very nice. Nice to see you, Lorena. Looking forward to seeing you tomorrow. Why do you recommend having a BMI lower than 30 when considering surgery? Um, there are a couple of reasons, and the first reason is that the complication rate is lower with a lower BMI. There's nothing particular about 30. 30 is one of the BMI cutoffs when they talk about sort of overweight to obese sort of thing. Is 30 is the cutoff between that terminology. And when they've kind of done clinical studies, you kind of have to have a point where you say, look, the clinical, you've got to group people into two groups. And so they often use 30 as a BMI cutoff, and they look at the group below 30 and the group above 30, and they say the group above 30 has got a higher risk of complications than the group below 30. But that doesn't mean anything particularly happens at 30. So if you're 29, it's not like you're saved, and if you're 31, you're doomed. It's a kind of a spectrum, and 30 is kind of the number that they use. So generally speaking, if someone asks the BMI, I usually say 30, but at the same time, if your BMI is 29 and you still want to lose weight, you are going to get less complications if you can lose weight. So I would say that I don't have a fix of as soon as you're 30, you can come in the door. That's fine. I would say get stable and comfortable with your weight. That's really when you be true to yourself, get to a weight that you're stable and comfortable with, and then that's when you want to think about having surgery. And ideally that would be below 30. Sometimes people have lost a lot of weight and they can't get below 30 and they still have it above 30, and so those sorts of patients, personally, I would offer them surgery. I know a lot of surgeons wouldn't, but I'd certainly talk to them about surgery, although I would highlight that they have got a higher risk of complications, but it's something you could consider. So the complications is one reason to recommend having BMI below 30. And the other reason to have a BMI below 30 is because you're going to get a better result. You're going to get a better clinical result. Often you're doing things like tummy tucks, and sometimes you have intra-abdominal fat, which can give you kind of like a barrel-shaped abdomen. So even when you've done a tummy tuck, paid thousands of pounds, you've removed the excess apron, the excess skin and fat. If you've still got intra-abdominal fat, you can still have a rounded look to your abdomen. The results often not great and doesn't look as good, and you still can kind of look big if you like. And so again, it's about having a realistic expectation of what you can achieve from the surgery. So often if you are big, inverted commas, you will still be big after the surgery, but you will not have that abdominal apron. Now you might say, I'm happy with that, I completely understand what you're saying, let's do it. And I'm like, well, okay, well, fine, but that's something to consider. The other thing is, if you were to lose weight after surgery, because I know a lot of people say, oh, I can't lose weight because of the apron or because of my breasts or because of whatever. If you then do your breast reduction or your tummy tuck or whatever, and then they're able to lose weight afterwards, and I completely understand how it is difficult to lose weight if you are carrying a lot of weight in those areas. But then if you lost a significant weight afterwards, then your breast might droop, your tummy might sag, so you might have extra skin in your tummy or your breast, because the reason you need the surgery in the first place is because of either weight loss or having children, because both those things stretch the skin. So putting on weight stretches the skin, and then when you lose the weight, the skin doesn't recoil. So you might have a bit of hanging skin on your tummy, a bit of hanging skin on your breast if you lost a significant weight after surgery, which would be a bit annoying if you spent a lot of money on a tummy tuck or a breast lift or a breast reduction to try and make the skin as tight as possible, and then you lost weight and then you had redundant skin. So you got less risk of complications and a better clinical result if you can lose weight and before surgery and be stable with it and comfortable with your weight, ideally below 30. But as I say, even if it's below 30, if you want to be lower than that, then keep going before you have the surgery. Yeah, Olivia's good. Good to hear, Olivia. Good to hear. What we got now. Things have been going on here. What's been going on here? What have I missed? Is the cost? I've done that. How long would someone need to be off work for pre and post a tummy tuck? Right, Amanda. Pre, nothing. You can be at work the day before. Sorry to tell you. So you don't need any time off work pre tummy tuck. Post, different story. Post tummy tuck, kind of depends what you do, whether it's physical or not. But general terms, the first week, no one's really going back to work, really. You've bent over, it's uncomfortable, it's not great the first week. The second week, you'll be feeling better and you will be doing emails from home, maybe not working unless you can just work by doing a bit of paperwork at home and stuff. But I normally would say to people 2 weeks, you just want to give yourself a break. It's quite a big operation, so 2 weeks you want to give yourself a break. In terms of driving and stuff like that, I normally say 2 to 3 weeks. It is different. Everyone's different. Oh, I've got a question. So, oh, what's that? Ask the quick. Sorry, backing a question. So, 2 to 3 weeks for driving. If you work for yourself, maybe 2 weeks you might be doing stuff. But if you work for a company or something, sometimes it can be a bit annoying if you say you're going to be all right at 2 weeks and you're not quite ready and you have to take another week off. So I normally say it's kind of safer to say 3 weeks in terms of driving and sort of getting back into office-based work. So I'd say 3 weeks you can get back into stuff, and then I normally say phase return or light duties for another 3 weeks. So 6 weeks before you actually putting any power through your upper body, any lifting, things like that. And even at 6 weeks, I would say you want to be taking it easy and just start putting power through, because you don't want to make it swell, certainly around your core and things like that. So 3 weeks off and then 3 weeks light duties, phase return is my normal regime for tummy tucks, and it kind of depends on your work. If you can do light duties, fine. If you can't do light duties, if your work involves heavy lifting, then it's 6 weeks, and then you can start gently getting back into it. Nikki Noobs, what is the complication rate of arm lifts / how long would you recommend for recovery for a wedding photographer? Lots of use of arms, lifting kit and carrying cameras for 10-hour periods. So is that the same? Oh yeah, I was excited that I thought I got a separate question. It's the same one. Okay. Nikki Noobs. So, oh God. Complication rate of arm lifts. Yeah, quite. So there's two things, I guess, when you're talking about cosmetic surgery. There's kind of complications and kind of what's the word? Not very good results. Kind of not looking good type thing. So complications is kind of like usually a kind of problem from the surgery. Usually within the first 30 days is traditionally is kind of like a complication. Wound infection, bleeding, hematoma, these sorts of things would be deemed complications. Skin loss, skin problems, skin necrosis, what have you. So these would be complications in the first 30 days after surgery. And any kind of body contouring surgery has to be closed tight. So there are risks of wounds not healing up. And if the wounds don't heal up, breaks down, you get an open wound, risk of infection. So the risk of that sort of complication is relatively high with body contouring surgery. And one of the problems with arm lifts, people do it slightly different ways, but personally, you make a scar goes from the just above the elbow up into the armpit, and then it's kind of like an L shape. So there's like an extension into the armpit, and the armpit's hot and sweaty. That L shape, there's a risk of that sort of point of that L, where the scar meets like that. There's a risk of the wound not healing up there. So you can get wound healing problems. You can get hematoma, blood collecting inside, and it all ballooning up. You can get problems with nerve sensation, usually in your forearm, nothing with your hands and stuff, but often in the forearm it feels a bit weird. Sometimes it comes to back to life, sometimes it doesn't. So there is a risk of permanent sort of funny feelings in your forearm. So this is what I would consider to be complications, and so they no question that would be something to think about if you were going to have surgery. But perhaps what people maybe would also, you might consider a complication, but we would probably consider more like a revision or what have you, is kind of someone it's all healed up, all fine, and it's technically all gone fine, but the patient's not happy. So that's obviously a problem, and something that we do our best to mitigate. But there are reasons for that. So and that might need kind of revision surgery, which is usually after 30 days to sort of do something if you're not happy. So the first thing that I always make a point of for patients with arm lifts is that the scar is quite long. It goes to just above your elbow. So if you're saying, oh, I hate showing my arms, I hate wearing short sleeve shirts or short sleeve tops, you might still hate wearing short sleeve tops after having an arm lift, because that scar will be visible. So that is a significant thing to consider. So you know that scar can be visible. Sometimes you get a bump at the end of the scar. It often settles, but sometimes it doesn't, and you have to remove it. Sort of when you end the scar, you get like a pleated tissue, so that is a risk. You know, hopefully the scar will fade, but it can take 6-12 months for it to fade, maybe even longer. It's quite a long time. And even when it's faded, you kind of see it. We hope that it's sort of hidden in a neutral position. So if you put your arm up there, you can't see it from the front or the back. But when you put your arm down, it is kind of visible there. And you know, you put your arm up, it's kind of visible. So that is a problem. So that is something to be thinking of. How long would you recommend for recovery for a wedding photographer? Lots of use of arms. So again, you'd be in the kind of heavy lifting group if you've got a lot of 10-hour cameras. So 6 weeks. 6 weeks you can start doing cameras and stuff like that, or lifting heavy stuff. 10-hour periods. I'm not sure if after 6 weeks you'll be ready for that, but you start getting into a bit of, you know, heavy lifting and stuff at 6 weeks is what is kind of normal. I'm not sure if you want to go straight into a 10-hour day, but yeah, that's kind of what I would be saying for you, Nikki Noobs. What we got? Amanda, thank you. Oh God, press the wrong button. Right, okay. So what else we got? I'll tell you what else we got. Why should you not pick a mole or try to remove it yourself? Good question. Good question. So the answer to that question is that really, before you do anything with a mole, you should go to your GP and get it checked. And I think a lot of times I get asked questions from people who aren't in the UK, and they say, "What's a GP?" And they don't have the fantastic NHS that we've got, that they can't just go down the road and see a doctor. And I know you're going to say, "Oh, it's hard to see them," but you know, you really should get your mole checked first of all, because you've got to be careful that it's not anything to worry about. It's not cancerous or potentially cancerous. So that's why you shouldn't do anything to your mole if you're concerned it might be cancerous. Now, if you're going to remove a mole, then it is always good practice to send it off for histology. So most moles, most sort of brown pigmented lesions, even though we clinically have said it looks benign, it doesn't look like anything to worry about, it's absolutely fine, it is good practice to send it away for histology, so you have got that peace of mind that it is fine. It's extremely rare, but it has happened where patients have had come back with years later with a lymph node in their neck or in their armpit or something like that. They biopsy the lymph node, and that lymph node is said that is a metastatic melanoma. So it's from a melanoma has spread to the neck or the armpit, but there's no obvious primary. There's no obvious mole somewhere. Now, sometimes that could be a mole that has regressed. So you could have had a mole that's then regressed and gone. But if you've had a mole removed 10 years ago on your hand or your neck or your face, you want to have histology to say that was not the melanoma, because you want to know whether that was the melanoma or not. So even though someone's saying, oh, it was obviously benign, that's a bit of a concern if this does come up later. So it really is good practice to send a mole away for histology, and you can't do that when you do that at home. There's all sorts of reasons not to remove moles at home. I'm sure I've done a video on it. You know, infection, not a clean environment. When you're removing a mole, you've got to remove all layers of the skin if you don't remove enough. So people talk about putting vinegar and all sorts of stuff on it, acids. You know, how much skin do you need to destroy? Because if you don't destroy enough, you still have a mole. It all heals and there's still a mole there. And if you don't destroy too much, you'll get extra scarring. So, you know, that is something that it's difficult for you to gauge at home as to how much of that skin to destroy, basically, if you're going to use some kind of goodness knows what people use at home. And I get asked all the time for home remedies. I haven't got any answers to that because I would not recommend it. I would recommend that you see a doctor and you have it removed in whatever way is deemed appropriate to get rid of all the mole with the least scarring, because that can be a bit haphazard if you try and do it at home. Not to mention infection risks and the lack of histology. Why should you not pick a mole? Well, you're going to make it bleed, you're going to traumatize it, you're going to cause scarring. So yeah, it's just not great. I mean, sometimes you can't help it if you hit moles when you're shaving and things, but you know, ideally you should try and avoid that. What is it? Right, hold on a minute. Do you, there we go. Do you recommend waiting for a period of time? Oh, let's get that. Do you recommend waiting for a period of time before having contouring surgery, in particular arm lifts, for bariatric patients, or would you suggest BMI 30? Yes, both, Nikki. I would suggest BMI 30, and I would also suggest a period of time. So BMI 30, as I said earlier, is kind of like the standard for doing body contouring surgery. But the particular issue with bariatric patients, if you had significant weight loss, is the concern that your weight is going to go up, and the concern that that's going to be your weight loss journey. So you kind of don't really want to do it as soon as you got to your weight, because you don't know what the graph's going to look like. Is it going to stay flat line, or is it going to go up again? So because if you have surgery to tighten all that skin and you put weight on, that skin's going to stretch again. Doesn't care that you spent thousands of pounds on surgery, it is going to stretch again. So you really want to be stable with your weight. Now, often in terms of NHS and stuff, when they probably don't do it anymore, but when they used to do it, they're often saying 6, 12, 24 months, quite significant periods of time in order to have proven stable weight before having surgery. Personally, and in the private sector, they are unlikely to be that strict. Certainly 12, 24 months is going to be unlikely. I think 6 months is reasonable, but I think, a period of time where you are stable with your weight, that you can be comfortable that that is your weight, because you want to get a long lasting result with your surgery, because you don't want to pay money and then 5 years later have the skin, put on weight and lose weight and all the skin's hanging again. So I think 6 months is reasonable, but yes, get to a stable weight and maintain that weight. Those are important things, particularly for bariatric patients, because you need to be sure in your own mind that you can maintain that weight. What is a realistic time frame to consider surgery for either a breast reduction or a tummy tuck before attending a big event such as a wedding? Is this as a we've had wedding photographer and wedding? Okay. So you're saying attending, so I'm assuming you're not like the bride or the groom, the tummy tuck. So I'm assuming that you're not the you're not the main contender in this event, because if you are in the main contender in this event, 6-12 months, in terms of scarring being red and active, numbness, odd feelings, shape, stuff like that. So 6-12 months if you're a main player in the event. But if you're just attending a wedding, as I say, 6 weeks you do feel pretty good. I think you feel better. You probably feel a little bit fragile, but I think you would be able to attend the wedding at 6 weeks. But as I say, your scars will be really quite red. You might still have some numbness. The shape might not be quite right. There might still be some swelling. There might still be some asymmetries. And I normally say 3 months is when those things start to settle. But as I say, if you're just attending a wedding, I would say 6 weeks is reasonable, unless you're a main player, in which case probably 6 months. So yeah, I hope that's helpful. Good questions tonight. Very grateful to everyone for giving me the questions as ever. Please carry on giving me the questions. I will do my level best to answer them in a way that I can be helpful and impart knowledge, because that's what it's all about, sharing knowledge. So if that'll be all, just got to check I haven't got any missed messages. I will check out of here and do a bit of DIY, putting a new tap on in the bathroom. So hope you're impressed. Got the old tap off, bit of cleaning. Now I'm going to put a new one back on again. Wish me luck. Hope there won't be any emergency plumber call outs. Probably not a good time to do it, isn't it? 10 to 8, probably not ideal. Probably should do this sort of thing in the daytime. In hindsight, just thought that just now. But anyway, what's going to happen? Constantly a tap. And I took the old one off, so it's just the reverse. In it. Actually, I've got to get the plug out. That's a bit more of a deal. Hold on a minute. What we got? Is Nikki come back at me? Nikki, you come back at me. Would you recommend waiting for a period of time prior to trying to conceive following arm lift surgery? Do you know what, Nikki? In terms of the absolute thing about trying to conceive after body contouring surgery, I would say, no, doesn't matter. Try to conceive straight away. Having said that, when someone asks that sort of question, there's always, I've got to be honest, a little bit of an alarm bell with me because I kind of think arm lift is not quite so bad as tummy tucks and breast lifts, because they're not directly affected, but your weight, you can have weight fluctuations when you do have children, pregnancy and children. So it kind of makes me think, if you're immediately trying to conceive, would it be maybe best to start to finish your family? Ideally, you would finish your family before having body contouring surgery. As I say, tummy and breast are more directly affected than arms, but I would still put it all in the same category of, if you're going to having body contouring, you don't want things to significantly change afterwards. And having children can potentially significantly change the shape of your body, because you will pay all this money to have your body contouring, and your body won't like leave your arms alone because you spend money on it. It might be that the skin in your arms will stretch if you put on and lose weight. So that's the only kind of slight worry I would have with you asking that question. I'm like, well, if you want to have that family, maybe you're better off waiting till the family is finished before you have surgery. But if you say to me, look, no, I want to have surgery now, and I'm in a good place, and our BMI is stable, and I'm comfortable, and all that sort of stuff, I'm like, well, you can have it. There's no problem with trying to conceive straight away after surgery. There's no issue with that, except for the fact that it may have an adverse effect on your body. Having children can have an adverse effect on your body. It should be a warning on the tin, as it were. But in terms from a surgical point of view, there's no problem at all. Thank you for answering my questions. Very helpful. 14 one day ago. That's all. Doing my best, Nikki. I'm doing my best here. Thank you very much for that. Thank you for your questions. And if you do have more questions, Nikki, do you know what? Next week, I'm pretty sure, I'm not on holiday or anything like that. So I'll see you, well, if you're around, same time, same place. So by all means, do ask questions. I love the responding to the sticker thing, or however you did it. That is very much appreciated. So by all means, do ask questions. I will be back right here, 7 o'clock next Tuesday. So